So today I want to talk to you guys a little bit about, well, first, my name is Rachele DeCrescenzo. I'm a physical therapist. My practice is called The Healing Journey, Myofascial Release and Physical Therapy. I've been a PT for about 17 years now, and the last few years I've been focusing mostly on myofascial release, and my practice is in Clinton. So I'm going to talk to you a little bit about understanding fascia, myofascial release, and trauma. And this trauma is a huge topic. Understanding trauma, treating trauma, it's way beyond, like a full scope of it is way beyond today's presentation. But I'm just going to give you a little bit of an understanding of it and how it relates to myofascial release. So before we kind of get into that topic, I want to just talk to you about what fascia is. And, a lot of people don't know what it is. Our fascial system, people have heard of the muscular system or your skeletal system, your circulatory system. We also have something in our body called a fascial system. The fascial system is a three-dimensional web of tough connective tissue, and it runs continuous from head to toe in our bodies, helps to give our body structure. On the right, there's a picture of fascia, and it does look like a web, and again, it runs continuous in our bodies. It doesn't begin or end at specific locations like we think of as with muscles or bones, but rather it's an intricate web. And also coursing through that fascial web is the ground substance or the fluid, which helps to hydrate the fascia and the surrounding structures. So in that picture on the right, the black is not just space or air, but more it's fluid. And that fluid helps to like I mentioned, hydrate and give, keep healthy the fascia that's around it. The fascia in our body surrounds and infuses every aspect. So we have this fascial web, this three-dimensional web, and then within the web is our bones and our blood vessels and our muscles and our nerves, and the fascia covers all of those things, and all the way down to the cellular level. So in that respect, because it covers everything and infuses everything, it therefore can affect every system in the body. And that's a big statement. You might be wondering, like, why, if it's such a big system in our body and it covers everything and it can affect everything in our body, why don't we hear more about it? And one of the biggest reasons is fascial restrictions, and fascia itself doesn't show up on standardized tests such as x-rays, MRIs, or CAT scans. So when you go into the doctor and you tell them you have a shoulder injury, let's say, and the doctor does an examination and he sends you for an x-ray, the x-ray is just going to show the bones, and it's going to show the space of the bones. And MRI is going to show muscles, nerves, blood vessels, but none of that is going to show the fascia or the fascial restrictions, which really could be the root cause of your symptoms. This is just a simple picture I like to put in to show what everyday fascia is, to help people understand that it is something that connects everything in our body. So if we all prepare chicken, you know that when you pull the skin apart, you see that white glossy stuff that holds the skin to the chicken meat, and that's the fascia of the chicken. And in an orange, it's also that white stuff that kind of holds everything together. Can you imagine if that white stuff wasn't in the orange? How would the orange get held, the peel get held to the orange? How would the slice held together? So in our bodies, it's the same thing. The fascia literally holds everything together. So the fascial system is a glide system, meaning everything moves and glides on each other within the web. So it's not just like you think of a spider web, it's a great visualization, but it's not just this this web that is stationary like a spider web would be, but rather it's always moving and responding and gliding to how our bodies move. So when our arm lifts, our head turns, the fascia has to stretch and move in the same exact way. And the fluid within the system also needs to move. So if you think of soapy water, and if you just put water between your hands and you move your hands don't necessarily glide on each other. But if you put soapy water between your hands and you rub your hands, now your hands can really glide and move on each other. And that's how the fascial system works. But when we have trauma, and this is what we're going to touch on a little bit today, is a trauma, whether it be physical trauma, like a fall, a car accident, or emotional trauma, stress, death of a loved one, could be even small little emotional traumas. So whether it's traumas, inflammatory responses from different injuries, surgical procedures, they can all create restrictions in that fascia. So instead of it gliding and smooth moving nice and easy, now it gets stuck, and it doesn't move as well as it should. And then if it's not moving and it's tight, the web isn't open the way it should be, and the fluid within the web isn't nice and soapy, but more viscous and thick, it's going to start to put pressure on all those things that the fascia holds together that can cause pain. So if the muscle can't work the way it needs to, and the nerves can't move and conduct electrical impulses up to your brain the way they need to, it's going to put pressure on the system, and it's going to create the pain or headaches or migraines or numbness or tingling, all those things. So I just talked a lot about fascia, but what's myofascial release? When we talk about myofascial release, well, it's a holistic, it's safe, it's holistic, and very effective hands-on technique that involves applying gentle, sustained pressure for a minimum of 3 to 5 minutes. And the time factor is really important because it gives the fascia and the ground substance or the fluid time to actually release. You put that pressure into the myofascial connective tissue restriction to eliminate pain and restore motion. And just like in this picture, this is like a very common release. It's just called a cross hand release. You can really do it anywhere on the body, but I would find the restriction by visually looking at the person, looking how they're standing, looking how they're moving. And then once I get them laying on my table, I'm looking and feeling their bodies to see what feels normal, what moves nicely and glides nicely, and what feels stuck. And when I find those stuck places, that's where I might sink my hands into, apply that gentle sustained pressure for at least 3 to 5 minutes, and a lot of times even longer, to really give the body time to respond and open up and start releasing those restrictions and then restoring motion. So as I mentioned, the restrictions can not only come from physical traumas, again, like a fall or a car accident, but they can also come as a result of emotional traumas and emotional stresses. And, you know, again, this is a really big topic. So kind of to go into why that happens or what's happening in the body is kind of really beyond that. But I just know that it can happen. And it doesn't need to be emotional, you know, huge emotional stresses, emotional traumas. It really can be small things. And it could be things from years ago. You know, let's say as a child, you were bullied a lot, or, you know, made fun of for different things, for wearing glasses or for being the bookworm or whatever it may be. You know, those things stick with your body, and they can really eventually come out as physical symptoms. So that's kind of the you know, the point here is that the emotional traumas can cause pain or cause restrictions in the body, and those restrictions can come out as physical symptoms. So in this really great book called Trauma, Healing Your Past to Find Freedom Now, very early on in the book, in the preface, the authors really set the stage for the book to talk about, the whole book is to try to answer the question, why Western medicine has failed to fully heal things like autoimmune diseases, depression, anxiety, strange digestive issues, migraines, brain fog, agonizing muscle pain, tension and aches, exhaustion, failed relationships, and addictions. And addictions can be really to anything, drugs, food, alcohol, etc. And they found that the more experts they spoke to, the more they kept hearing about trauma and how unresolved pain is often the root. So it's a huge topic, and luckily becoming more mainstream, although, you know, Western medicine just doesn't really dive into this and talk about it very often. I want to talk briefly about the fight, flight, and freeze response. So a lot of people have heard of the fight and flight response, right? It's when, I'd like to think about it in nature. It's really kind of an easy way to think about it. If an impala is being chased by a lion, the impala is doing everything it can to get away. It's using all of its energy to fight and flight, to free itself, to get away from the impending danger that of being caught by the lion. So it takes all of its energy to try to get away. And by doing that, its adrenaline is up, and it's pupils are dilated, its breathing is heavier. All these things happen physiologically in our body, whether it's with us or in nature, the impala trying to get away from the lion. That happens. And then if, let's say, the lion does catch the impala, one of the things it can also do is freeze. So it literally basically plays dead. It's not dead, but it uses all of its energy to pretend like it's dead. And if the lion, thinks they killed it, sometimes they'll walk away. They get disinterested in it. This happens in humans too, this fight or flight response. Think about if you've been in a car accident, or you've been scared for some reason where you're trying to get away from some type of danger. These things happen in our body, and it takes a lot of energy to fight or flee or get away. And it's a very primitive response. It happens innately. We can't stop it from happening. It happens innately and subconsciously. In nature, animals will, when the impending danger goes away, so let's say the lion is disinterested in the impala, it doesn't eat it, and it walks away. That impala will take all of that energy that it just used to try to get away, to save itself, and it will shake and find a way to expel that energy out of its body. So now that trauma does not get stuck in its body, the energy doesn't get stuck there, it finishes the response. So it fights, it flights, it freezes, and then it thaws that freeze by shaking and trying to get away from the trauma. Very often with humans, we don't finish that traumatic experience. So instead of thawing the freeze and shaking out all that energy and getting rid of that energy, it gets stuck in our bodies. And during times of trauma, the subconscious develops a protective pattern that becomes locked in our mind-body complex, like a frozen moment in time. Something that we really can't control. So with myofascial release in this safe therapeutic environment in the office, we can help unlock these protective patterns and help the body finish those traumatic experiences through the work that I'm doing with the MFR. So we're allowing the patient, if the patient feels safe and protected, they're allowed to now move into those positions of space of past trauma, and the instinctual bracing patterns that we don't even know we're holding on to can be released, and it allows that freeze response to be deactivated. Again, from that same book I just showed you, they say that treating trauma is a highly individualized process that frequently requires a multi-pronged approach by combining some form of therapy, body work, which is MFR, deep inner discovery, along with lifestyle and self-nurturing practices. They make a point to say it's not something that happens after one therapy session, but it's truly a journey. I love that they use the word journey. That's the name of my practice, the healing journey. And that is what it is. It's, people want a quick fix. They want to pop a pill and feel better. And unfortunately, that's not how true healing works. When you really want to heal from something and really get to the root cause of your problem, it is not a quick fix at all. And what I love about MFR is it really combines all those things that these authors are talking about. It's not talk therapy, but I form such intimate relationships with my patients that they often do feel very comfortable telling me things and talking to me. And I'm not trained to be a psychologist by any means, but I'm able to listen, and to sometimes just having somebody listen to you and being able to talk and tell what is going on is so important. Just getting it off your chest and having somebody listen that's not judgmental. And I try my best to have a non-judgmental approach when I'm with my patients. Obviously, the body work is the MFR, the structural MFR, and the deep inner discovery. So, I'm very often asking my patients to really to feel, as a society, we sometimes forget to really kind of feel our bodies, feel what we're feeling. Like if we're sad or we're mad or whatever, we kind of stuff those things down and we just keep moving on because our lives are so busy. So MFR really allows us to feel what we're feeling, and that's so important, and express what we're feeling. And then, beyond what I do in the office, I'm asking people to do self-care at home and self-nurturing practices. So not only just self-care, meaning stretches or different exercises, but often I'll ask my patients to journal, to write down what they're feeling, and to write down what their thoughts are after a therapy session with me. So the authors of this book talk about this multi-pronged approach, and MFR is so much of that, all in one beautiful modality. It kind of combines all of those things. Another really wonderful book is this book here called The Body Keeps the Score by Dr. Bessel van der Kolk, and he's a psychologist. And I love the title because it kind of says so much. The body keeps the score. And I talked so much, like, again, this topic of trauma is just huge. But our bodies remember things subconsciously. We don't know it, but they do. And Tracy actually recently used the same exact quote on her Facebook page, but it's a quote that I love also from this book and from Dr. Bessel. And that mainstream medicine, Western medicine, is firmly committed to a better life through chemistry. And the fact that we can actually change our own physiology and inner equilibrium by means other than drugs is rarely considered. Again, luckily it's starting to be a little bit more considered, but popping the pill is not always the best answer, and it's definitely not the easiest answer. Well, it is the easiest answer, but it's not the answer that gets us to where we want to go most times. So MFR is really this multi-pronged approach to treating the whole person, body, mind, and spirit. And, it opens you up. It's so much more than the structural work of opening the web, that fascial web that I was talking about, and rehydrating the web. It's so much more than that, because it allows us to feel into our bodies and really experience the things that we've gone through and get to the root cause of our problems, instead of just putting Band-Aids on them with pills or surgeries or other things. So that's, again, I know it's kind of, it's a big topic, and I hope I gave you a little bit of an better understanding of it. And if anybody has any questions, I'm open to that.